Hi everyone, I'm going to talk about maternal nutrition in this video. Again, this information that I would be speaking would be from the ATI book. So over here, we're going to discuss about like the normal weight gain for pregnant women. So usually a pregnancy for a normal person with normal weight, average weight would be, the weight gain would be expected from 25 to 35 pounds. And then the rule is during the first trimester of the pregnant person, an expected gain of 2 to 4 pounds. And after that, it's going to be 1 pound per week for the last two trimesters. So basically, the second trimester and the third trimester. As a nurse, it's really important to assess the client's gain so that there's no excess calories, and also help the patient to develop a postpartum nutrition plan. There are some things that you can assess or information you can get from the client whenever you're doing assessments. So it can be either objective or subjective. You can get the journal of the food client's habit. You can also give some questionnaire, health history, if they have like previous diseases and like example diabetes and stuff like that. Lab values like making sure to review the hemoglobin and hematocrit levels, and yeah. So all right, for calories, the expected calorie for the first trimester is 0 during pregnancy, and during the second trimester, there is an increase of 340 calories per day, and then on the third trimester, it's going to be 452 calories per day, and then if the female is planning to breastfeed the child, the infant, then she's gonna have to increase the calories to 450 to 500 calories per day. In order for a woman to maintain a balanced diet during pregnancy, they are also required to take prenatal vitamins. So one of the prenatal vitamins would be iron. Iron is needed because it helps facilitate the increase of the red blood cells, because they have a tendency to experience anemia. And then iron supplementation is required if the hemoglobin level is less than 10 grams. And then when they're taking the iron supplement, they usually drink orange juice, and then not other like liquids like milk or caffeine. Another supplement that they are taking would be the folic acid, and this is important because it prevents neural tube defects to the baby. And examples of this one would be like foods that are rich in folic acid would be green leafy vegetables, orange juice, also dried peas and beans. The March of Dimes recommends that the client who wish to become pregnant take like 400 micrograms of folic acid, and then the pregnant person itself, they need to take 600 micrograms of folic acid. But in our book, it says that it should be 1 milligram per day for the reproductive age women. Another nutrient is calcium, because this is important in the development of the bone and teeth of the baby. And then some sources of calcium, again, as are common, would be calcium milk, fortified milk, nuts, legumes, and also dark green vegetables. For a female who is 19 to 50 years old, either they're pregnant or non-pregnant, the requirement for calcium is 1,000 milligrams per day. And if they are below 19 years of age, the requirement would be 1,300 milligrams per day. Other nutritional consideration would be there is no supplementation for vitamin A because most women or all of them have adequate levels. And also, when it comes to fluid, they need to be hydrated. So they're required to take 2 to 3 liters per day, or equivalent to 8 to 10 glasses per day. Also, limit the caffeine intake to no more than 300 milligrams of caffeine per day, because too much caffeine can contribute to infertility, spontaneous abortion, or IUGR. And also, if somebody's pregnant, they're not supposed to be smoking or drinking alcohol because it can lead to various complications. During pregnancy, there are some foods that are needed to be avoided. So some of them would be deep sea fish, including would be the swordfish, shark, or mackerel. And if they do consume albacore tuna, it needs to be limited. So every week they can only consume no more than 12 ounces of albacore tuna. Again, mercury exposure can cause different problems such as CNS abnormalities and other nervous system problems. Other items that are really good but need to be avoided would be homemade ice cream, raw eggs, and cake batter. Also, because of the possibility of having listeria bacteria, they need to prevent eating from hot dogs or deli meats, unless the hot dog would be either cooked in a certain temperature, like 150. I forgot, but it needs to be cooked properly. Also, they need to avoid like uncooked meat like sushi and sashimi.